This week's topic is interprofessional collaborative practice and education, and it's a really important concept in healthcare as we move towards a more integrated system of the delivery of healthcare services. So today's healthcare workforce is being asked to work in a more collaborative, integrated team model with the goal of achieving and delivering patient-centered care that's safe and effective and meets the needs of a complex and growing population, particularly with regard to the aging population, which, as you know, is the population that is growing the most. So this vision for a collaborative practice is being fueled by the interprofessional educational movement that's emerged on a national level. And this momentum that's building in the academic and practice setting is supportive of this greater vision of a healthcare system that is collaborative and interprofessional. So in order to sustain the momentum and make interprofessional collaborative practice a reality, leaders in the healthcare industries and educators have to critically evaluate the culture of the healthcare systems, the systems and infrastructures that are currently in place in terms of the medical system. And healthcare organizations have to understand that collaboration is more than just working together and working well with others outside of its traditional care circle. So there are a lot of components. It's more than people working together. It's also a commitment to a different operational framework and acknowledging that this integrated system of healthcare and the workforce will need new tools, need additional resources, need technology that can promote the demands of this kind of team-based model. So it's more than the people resources that are necessary to achieve this vision, but it's also the infrastructure, the tools, and additional resources that are necessary. So the World Health Organization defines collaborative practice as something that occurs when multiple health workers from different professional backgrounds provide comprehensive services by working with patients, their families, caregivers, and communities to deliver the highest quality of care across settings. This effort is supported by a growing body of evidence that demonstrates that the incorporation of patient preferences contributes to higher value health care. So it's also about getting the input of the person who is receiving the care to improve their outcomes. So value is also enhanced when the patients, the families, and the communities assume an increased responsibility for factors influencing health. So it's not about the provider being responsible for the person's health, but the person and their family also taking on some of the responsibility for their health outcomes. So inextricably linked to all of this is interprofessional education, which the World Health Organization defines as occurring when students of two or more professions learn about, from, and with each other to enable effective collaboration and improve health outcomes. So that statement is really important, and that's the topic of your interprofessional practice reflection assignment that is going to be due next week. So in 2009, there were 6 educational associations of schools of health professions that got together and formed a collaborative whose mission was to promote and encourage the efforts that would advance interprofessional learning experiences and help prepare future health professionals for team-based care of patients and improved population health outcomes. So these organizations created core competencies for interprofessional collaborative practice to guide the curricula development across health professions school. So together they became the Interprofessional Education Collaborative. And I'm just going to hop on this for a second to show you. This is the vision of the Interprofessional Education Collaborative. They have a very good website that has some resources. I considered having you guys do one of the archived webinars. I actually just signed up for one to see how it works, but I decided not to do that. But it is an available resource if you decide that you want to get a little bit more information on this topic. They are free webinars, particularly the ones that are archived. So you can look at the topics and they just ask you to sign up. You can sign up as a member of a healthcare organization. I used the American Occupational Therapy Association, and use your your school email, and you can sign up to participate in one. As I said, they are free. You'd get an email with a link. So that's available to you if you would like to do it. But you can see the vision and mission of this collaborative group. The vision of the future is that interprofessional collaborative practice drives safe, high quality, accessible, person-centered care and improved population health outcomes. That's a huge statement and a very lofty goal, but one that I think is important to healthcare. So you can look this over a little bit. They have their mission statement, their goals and strategies. They want to be the leader for advancing interprofessional education, promote, encourage, and support the academic community in advancing interprofessional education efforts, and inform policymakers and key influencers about the important contribution interprofessional education makes to addressing the healthcare needs of the nation. So it's kind of designed to be this collaborative effort between the educational institutions and the healthcare industry to provide care that is focused on the collaborative efforts, but also with the patient at the core of the delivery of the services, as it should be. Okay, I'm going to pop back to here. And part of the original panel, so in 2011, they convened a panel and focused recommendations. So they made specific recommendations to the profession that were focused on core competencies for the delivery of interprofessional education, interprofessional collaborative education, and identified 4 domains for core competencies. This particular panel was focused on the professions of medicine, nursing, pharmacy, dentistry, public health, and other health professions, but they also are focused on other health professions as well. So in 2011, they developed these core competencies that were based on the Institute of Medicine's competency, and again, organized them within 4 domains. The first domain, values and ethics, and that one is about working with individuals of other professions to maintain a climate of mutual respect and shared values. So that's what falls within domain 1. The second domain of competency is roles and responsibilities. And that one was defined as using the knowledge of one's own role and those of other professions to appropriately assess and address the healthcare needs of the patients and populations served. So you notice here what a term that keeps coming up is population. So it's not about the individual healthcare needs, but also the healthcare needs of the greater population, of the greater community, which is important to bear in mind as well. The third competency domain is interprofessional communication, and that's communicating with patients, their families, other health professionals in a responsive and responsible manner that supports a team approach to the maintenance of health and the treatment of disease. And finally, the fourth domain, team and teamworks, and this applies to the relationship building values and the principles of team dynamics to perform effectively in different team roles to plan and deliver patient population-centered care that's safe, timely, efficient, effective, and equitable. So you can explore those core competencies more in a couple of the documents that I posted, as well as on that Interprofessional Education Collaborative link. So why is interprofessional education and interprofessional collaboration important? Well, it's really important because the exchange of information is a critical factor in all phases of collaborative patient care. And the impact of that exchange of information, or in some cases, that lack of exchange of information, can be profound. Failures in communication have accounted for many medical errors that can be attributed to poor healthcare team interactions. There was one study that was done, or a compilation of studies, that said that about 70% of all medical errors can be attributed to poor healthcare team interactions. It's also been reported that when surgical teams less frequently share information during intraoperative or handoff phases, there is an increased chance of major complications or death. So, in addition to all of this, these competencies, those 4 competencies, align with a similar effort in healthcare that's equally important, and that's the Institute for Healthcare Improvement's triple aim approach to healthcare system performance. And the triple aim encourages that new designs of healthcare be developed to pursue and share accountability for 3 dimensions. And those 3 dimensions are improving the patient experience of care, including quality and satisfaction. Quality is going to be a huge buzzword as we move forward in healthcare, hopefully. It was an important part of the Affordable Care Act. We'll see if it remains to be an important part of the American Health Care Act. The second part of the triple aim is improving population health. And there's that phrase again. So improving the health of populations, not simply individuals. And the third prong of that triple aim is reducing the per capita cost of healthcare. So bringing down the cost. And one way to do that, it has been documented through interprofessional collaboration. So having reduction in the provision of duplicate services and things like that, and better communication, has been demonstrated to show reduced costs. So that's where these that's where these concepts are linked. But there are some challenges to being able to implement interprofessional education or collaboration. So proponents of this see the model as a way to meet the objectives and requirements of healthcare reform and patient-centered care. And, those are great, but it can be difficult to implement this philosophy, and more so even the philosophy, but integrate the practice within settings. So there can be lots of hurdles in the way. So there can be these what seem like immovable boundaries that separate different departments and different disciplines. If you've ever worked with someone from a different discipline, it can be challenging. It's like a culture shock. And getting a person to try to change the way it's always been done and shifting the mindset from an individual problem solving to a team-based care and planning treatment can be challenging. Mammoth change doesn't occur in a vacuum, but it takes place among the many healthcare reform initiatives. So, it's healthcare, it's making change in the midst of change. We're in the process of changing healthcare, but we're asking for other change to kind of happen in the background. So that can be a challenge. The physician's role is evolving from what used to be an independent practitioner role to more of a hospital-employed collaborator. And the roles of these leaders of these hospitals are expanding and some responsibilities being elevated. And as these new models of staffing emerge, they're happening in the midst of shortages in many areas of the healthcare workforce. So this talent pool is shrinking, demands may increase, and these workforces are being stretched thin. So, it can be tempting to just kind of try to push forward and do what you do the way I've always done and not rock the boat. But, that's not always in the best interest of the people we serve.